Now we're going to move on to On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. COVID-19 oral antivirals are starting to hit markets around the world after winning approval from health authorities. Experts say these pills are vital in many ways, not least because they have the potential to help already really overburdened healthcare systems reduce the strain of a potential influx of COVID-19 patients as the winter closes in, as we just heard is happening in Europe right now. That being said, experts also say that these drugs are not any kind of panacea, and vaccinations are still the best option to try and stem the spread.
Yes, and for more, we connect to Katherine Seley-Radtke, professor of chemistry and biochemistry at University of Maryland, and also serves as president-elect of the International Society for Antiviral Research. Good morning, Professor.
Good morning.
Now, firstly, how important is the introduction of these antiviral pills in the fight against the pandemic?
Extremely important, because vaccines are obviously important too. They protect us from getting the virus, but they can't kill and they can't treat the virus. And so it's really important that we have both to fight the coronavirus. In addition, a lot of people can't get the vaccine. Maybe they're allergic to the components, or they can't mount a good immune response. And so it's really important to have the drugs available to treat them. And we also have to think about people in rural areas and underdeveloped nations where they just don't have the healthcare system and hospitals that we do, and that some of the rest of the world does. And so that's what makes it important to have the drugs available, because they can easily be transported and given at home prior to people who would have to be hospitalized. 80% of the people can be treated at home if it's caught early.
Right, because that's one of the big issues. The supply is going to be limited at the outset, and there are these questions swirling around about who should be the top priority when it comes to receiving them. There are also concerns that developed countries are going to essentially vacuum up the entire supply at the expense of poorer countries. Some also express worry that these drugs will encourage the virus to mutate even further. Some have made that argument for the vaccines as well. But do you share these concerns regarding the pills, and what else should be considered before these pills start hitting markets around the world?
Well, I can't really speak to the idea of nations grabbing things up. We have to work together. Until we kill this all over the world, it's going to continue to replicate and infect people. But your latter point about it causing mutations is actually the opposite. We use combination drugs or drug cocktails to successfully treat viruses for many years. For example, we use 2-drug, 3-drug, and 4-drug combinations to keep HIV at undetectable levels for a patient's entire life. We use combination drugs to cure hepatitis C, HCV, and you can exponentially decrease your chances of developing resistance if you use these combination drugs. They have a number of benefits besides cutting down the resistance, but that's probably the most important thing.
And Professor, well, as of now, we know that we have 2 antiviral drugs, molnupiravir made by Merck and the Paxlovid developed by Pfizer. When it comes to how they fight the virus, what are the main differences between the 2?
Well, they stop the virus replication at different steps. And so molnupiravir stops the virus from replicating by sort of inducing numerous errors in the RNA-dependent RNA polymerase, and that causes the wrong nucleotide to be incorporated, and that in turn keeps happening and happening and happening until the virus just can't function anymore. And then the Paxlovid actually works by inhibiting the protease. And the protease is an enzyme that's important in the virus's replication pathway for sort of cutting the bigger piece into smaller pieces, which then go on to be the new virus particles. And so they really work by different mechanisms, but complementary mechanisms.
And finally, the EU's medical watchdog has approved Regkirona. This is an antiviral made by the South Korean firm Celltrion. Rather than being taken orally, though, we must stress that this is administered intravenously. Some researchers in South Korea, they say this particular drug is better than molnupiravir because it's cheaper and more effective. What do you know about this South Korean firm's treatment, and do you share similar concerns about the potential safety and cost of molnupiravir?
Well, I don't know what the cost of the Regkirona monoclonal antibody is, but I did have followed this, and it seems to work very well. It's really reducing the risk for high risk patients by quite a bit. I believe it was 72%, and where molnupiravir was only about 50%. Now, obviously, you still have the issue of having to go to the hospital to be treated. And because of course, it has to be given by infusion or by IV, just like remdesivir did. But there are concerns about molnupiravir because of the fact that the mechanism by which it works, lethal mutagenesis, can also affect our own polymerases. And there have been some studies out that have shown that this may be possible. And so that would be detrimental to us and could potentially cause toxicity. However, I think we sort of need all of these to go forward and to treat this virus.
All right. Thank you, Professor. It was interesting getting your thoughts, and we appreciate you joining us this morning.
Thank you. Thank you for having me.